Harmonic Energetic Technologies presents Life Inspired Lecture Series.
Welcome. I'm Stephanie Holland, founder of Biofeedback Wellness Center and Frequency Apparel. Grace Gow has given me the honor and opportunity of demonstrating an effective method of testing called baseline stressor testing. During this demonstration, I will utilize the reactivity along with 9 wellness panels in identifying and addressing the top energetic stressors. This method allows the practitioner to compare and analyze stressors, resulting in a pattern, providing a direction in applying energetic feedback utilizing the life system. Later today, Dr. Gena will demonstrate the same method while working on a lamb. Today we're going to be working with an 82-year-old male who has a history of short leg syndrome causing hip and knee pain. In addition to that, he recently had a stroke and continues to have TIA episodes on a monthly basis. We're going to start out with the calibration. And during the calibration, I want to show you the 10 steps that we're going to follow today in the baseline testing. You'll be able to download these 10 steps along with the charts that we're going to use today from our website, biofeedbackwc.com. You'll follow the link and be able to download each one of these and print them for your own use. Okay, so we're going to first go into the wellness panel, and we're going to balance, test, and balance the geopathic stressors. So once we get the geopathic stressors balanced, we will proceed on to the reactivity. We will run a reactivity test. The second test that we're going to use in this process is the acumeridian systems. Third, we're going to go to miasms. Fourth, cell-com. Fifth, chakra. 6, dental. 7, detox. 8, organs. 9, spinal test. And then 10, we're going to test the vitamins, minerals, and amino acids. In each of these panels, we're going to look at the commonalities of each panel along with the reactivity to come up with solution for this client to alleviate the stressors in his life. These are the charts that we're going to use. We're going to have the Meridian chart, and as you'll see, it has each meridian, and it also has the organs that are affected, or the actually parts of the body that are affected when the meridian is stressed. We have the chakra chart, and it follows the same suit. Each chakra is tied to different organs and also even emotions in the body. We have a dental chart. I love the dental program. I feel like it's underused, but each tooth is tied to certain organs or glands in the body, and also to vertebrae. We're going to use the spine chart, and each vertebrae is tied to body parts, organs, and so we're going to be looking at that. We're going to be looking at minerals that are out of balance. We're not going to talk about whether they're high or low. We're just going to talk about if they're out of balance and what the health effects could be from that, health stresses. Same thing with amino acids and vitamins. On each of these charts, you have a backside, and it actually tells you some of the things that you can look at when they are out of balance. Okay, so we've fed back the geopathic stressors, and we're ready to go on to the acumeridians. Okay, we're ready for the first step, which is reactivity. So from the wellness panel, we're going to click reactivity and test potential. This test usually takes about 8 minutes to run. And while that's running, I want to explain a few things, procedures that I always use when utilizing the reactivity in my baseline testing. After this is complete, I will go over each individual panel here and look at commonalities, things that might fit together, and a baseline to start my baseline testing with. Also, after it finishes and after I review everything, I will create a custom data program by right-clicking my mouse and adding items. The first items that I always add are polarity. So if you go to the search, enter search item here, and you type in polarity, 3 items will come up. Linol for female, Zucker-Wasser for male, and false polarity. The false polarity is for male or female. And what polarity is if your body is in correct polarity, it's in healing mode. So the cells need to be in healing mode to be fully receptive. So I use those 3 items and only choose, if it's a male, I use the Zucker-Wasser, and if it's a female, I use the Linol. And so along with the false polarity on each one of them. So I do a search and I actually right click and I add whichever ones are appropriate first. And then in the reactivity, I add the first 25 of my acute, or you can add 20, it's just up to you. And the last page, which is about 20 items in the chronic, the green section, and those, I usually focus on the zeros in those. So once I get those placed in the custom data program, I either place it on 15 minutes, which gives about 20 seconds feedback for each item, or I'll put a 0 in and hit metaspace, and I will let it run until the items get to 90 to 100, which usually 15 minutes is appropriate for that. So I'm going to come back when this is complete and we'll continue with the review. Okay, so now we're to step 1, where I've completed the reactivity test, and I'm going to review the top, the red, which is acute, and I'm going to review the zeros on the bottom, which are chronic. I usually focus only on the zeros because, as you know, the green section is pretty massive, but I do look at all of the red. So to start with, the way I go through this is I start with categories. So allergens, it shows that he does have several stressors here. Actually 1, 2, 3, 4, 5. So I'm probably going to look at stressors that are caused by allergens along the way. Amino acids, no red. If I go down, there's nothing in the 0 there. Ayurvedic, which is your homeopath. It looks like he has a urinary antiseptic, so I would look maybe for some bladder or kidney stress. Anti-inflammatory, that could fall around the same thing, and also analgesic for pain. And then just a mild tonic, and also bronchitis and asthma, which is the lung area, so I'm going to look also for stressors there. Okay. Bacteria, the same thing. He has glanders bacteria, looks like, as a stressor. And I do know that this client does work with animals, has cattle and horses. And so he very well could have picked that up through working with his cattle and horses. Okay. Bones. Nothing in the area where I'll look. Brain, periodic paralysis and stroke definitely goes along with the diagnosis of stroke and TIAs that he received from his doctor. Spinal bifida is at 7. But you remember he also has had short leg syndrome. Okay. Chromosomes, everything looks okay there. Circulatory, no zeros there. Dental, he does have a, looks like a filling or some kind of dental appliance. Also on the bottom on the zero, he has the same thing. Digestive, nothing in the zeros and nothing in the acute. Okay, so diseases, he has mastitis, so we're looking at swelling in the breast area. Probably this proteinuria is protein in the urine. We'll look for kidney and bladder stress. The vein walls, inflammation of the vein walls, which kind of goes along with his diagnosis from his physician. Simple parietal seizures, that fits. Mononucleosis, which could be, that when I see these come up, I realize that the system is set to send, even if the person you're working on has a sore throat, fever, or fatigue, and they need that frequency, it's going to give it to them. The next one is herniation of the meninges and spinal cord. That very well could fit with his short leg syndrome. Nematodes looks like some roundworms. And then there's issues here in the cerebral hemisphere. If you go down to the bottom, there's a 1, which is eye disorder, and so no zeros. Okay. Drainage, it looks like maize rootlets, which corn silk are a diuretic, so it's sending out a homeopath there, and also kidney drainage. So I'm going to continue to look at the kidney and bladder for stresses. Okay. Ears. Okay. Nothing there. Nothing in enzymes. Eyes, there's nothing there that I would list. Looks like some emotional things going on, so it's sending him a Bach remedy. The Bach remedies are awesome. And so he's also on the bottom, same thing, discouragement. So he's getting 2 Bach remedies in his feedback. Fungus, looks like sinus related fungus. So we did see a lot of allergies that would tie in. Glands, heavy metals, let's see, nothing there. Homeopath. Looks like this homeopath may be for inflammation and pain. Looks like some of the things that it treats. This next one's cardiovascular system, also dimness of sight, and his eyes have come up. This is for sciatic and paralysis, and we know he's had stroke and also the short leg syndrome, so all of those homeopaths make sense. And the very bottom one is for a swollen soreness of the upper arms, which makes sense with the mastitis. That kind of ties in with that stressor. Hormones. Okay. Lymphatics. You got a lymph stasis, which just is going to support and clear his lymphatic system. I probably would add that one in when I'm working, just because of the other stressors that it's shown. Meridians. The TE20 shows stress, and that's really interesting because it shows stiffness of the neck. It also shows tooth decay, toothache, and he did have a couple dental issues come up, and then it shows tinnitus, which is really, I see that frequently with stroke victims. So, miasms. I see nothing there. Muscles. At 1 is his psoas major. That is tied to his lower back. He has lower back pain from the short leg, and also emotions are tied to the psoas muscle. So that makes a lot of sense to me. Okay, nothing under nerves. Nosodes. Rocky Mountain tick fever nosode. So that's really interesting. So we might want to look for some kind of tick-borne stressor in his system. Parasites, there we go. We have Rickettsia, and that's tied to tick-borne stressors. So, and then it looks like a human tapeworm. And then a roundworm. Okay. Pesticides, none. Respiratory, pulmonary edema, again, up in the chest area, the mastitis and the inflammation that it talked about earlier, and then the pulmonary edema. Sarcodes, occipital lobe would be vision, and then anus could have to do with the parasites, because that is a homeopath. Okay. Sinuses. Okay, nothing at the 0. Spinal, the clavicle, back again in this area. Several things about inflammation and swelling stressors. That's in the spinal. Toxins, and that has to do with the dental. That ties in with the dental. And then if you'll notice here, it's 10, but it does say Rickettsia, and that ties in with what we saw earlier in the parasites and also in the sarcodes. Vaccines, nothing. Viruses, nothing. Vitamins, CoQ10 has to do with normal heart function, and that ties in with what we're seeing as far as the stress. Vitamins and minerals, okay. Miscellaneous, bone, pineal, stress, responsibility, conflict, dwelling on unpleasant, and then the musical note, TI, which is tied to the crown chakra. So that makes sense as far as the strokes. So what I would do here is I would click all. One of the first things I like to do is I like to search for polarity, because your body needs to be in correct polarity in order to heal, for your cells to be in healing mode. So the first one is the polarity for yin. The second one is to correct wrong polarity, which would be in your body would be in stilling mode instead of healing mode. And the third is yang. So the first one is for women. The second one is a general one for wrong polarity. And the third one is for men. So what I would do is I would add in my custom program, I would go with the second two. And then I'd close and I go back to all. And then I'm going to work on the acute. So I'm going to go down and add the top 25, okay? So that would put me at 27. And then I'm going to go down to the bottom, and I'm going to add a full page of the chronic. And what I do here is I set this on a 15-minute timer, and I let that run. So we've completed the custom data, the custom treatment data, and we've balanced everything up in everything's balanced to the high 90s and 100, including the polarities. And so what I did from this point is I came up with 5 top stressors that I gleaned from the reactivity. And if you'll look here on the board, I put them in my step 1, weak vascular cardiac stress, parasites including GI and tick-borne parasite stressors, weak eyes are a stressor, inflammation, pain in the chest area are stressors, lower back pain and leg pain are stressors. So again, I want to make sure that you understand we do not diagnose. We're going from the diagnosis that this client has given us from his doctor, and we're indicating the stressors so that we can help equip him to self-heal in these situations. Okay, the next step that we're going to go to is step 2. And step 2 is acumeridian systems. So we're going to test the acumeridian systems. Okay, so in the wellness panel, we're going to test systems. Okay, after we test the systems, we're going to use our first chart. And like I said, again, these are available on biofeedbackwc.com. And we're going to look at this chart of, I usually look at anything above 75 or below 10. I try to give a minute feedback on the top 3. And then I do a minute feedback on everything under 10 because it's super important. The meridians and the energy flow through the body are very crucial to our health. So if you'll notice, I would write down everything under 10. I'm just going to start with the bladder meridian. So the bladder meridian is at an 8, and that includes the corpus callosum and the mucous membranes. Well, the corpus callosum is part of the brain. We know that he has had strokes. Also, the mucous membranes are tied. It could be tied to the sinuses. It could be tied to anything drainage related in his body, and we have identified several stressors in those areas. The gallbladder is at 63. I would go ahead and look on the chart to see what that affects. That's ears, emotions, and memories. So with this client, I would say, in lieu of what I usually do, I would look at that because we know that the ears had shown up, the emotions had shown up, and I do know that this client has reported memory issues. So I would take note of that. The kidney meridian. Now, the kidney was indicated several times in the reactivity, and the kidney meridian also covers the kidney and the bone marrow. So the kidney meridian is at 5, and I would make note of that and definitely give feedback on the kidney meridian. The liver meridian is at 13. Because we have several, I would go ahead and look only at everything under 10. The lung meridian, which is the nose, skin, shoulder, and back. We know he has some back pain. And it also has shown some neck stiffness and the reactivity. The pericardium is at a 3, and that's his parasympathetic. His pineal did show up several times as stressed, so he may be having trouble relaxing, or it could be just the opposite. He could be relaxing and sleeping a lot. So I would make note of all of those. I would do I would definitely go down through here, and I would start with the bladder and do a 1-minute feedback on each under 10, and I would include the gallbladder within that category. So we're finished with the acumeridians, and before we go on to the third step, I want to show you on our board the update. And so we've added the stressors that we found: ear, emotions, kidney, bone marrow, parasympathetic, nose, skin, shoulders, and back. If you'll notice, the weak vascular cardiac, that has to do with the blood. We've got bone marrow here. We've got ears and emotions, and that came up along, we didn't write emotions down, but it did come up along with weak eyes, and there was some tendonitis that had showed up. The parasympathetic the nose, the skin, the shoulder and back. So we've got inflammation and pain of the chest area. That could be tied to the shoulder along with the stiffness of neck that showed, and then the lower back pain. So we're starting to draw a picture here. And the next thing we're going to test is miasms. So here, let's go back to the wellness panel. And let's go to aging and miasms. Now I want to tell you, you can use any of these different wellness panels to do the same thing. You do not have to follow the ones that I do. It's just my favorite ones, and that's what we're going over today. So I'm going to test the miasmic test, miasmic factors. And especially, I like this one because after seeing the parasites that he had in his reactivity, and also the SAR code that showed up for the tick-borne illness, I use the miasmic factors when I have a suspicion that that might be part of the stress. Okay, so SOAR shows up, and that's interesting because skin, SOAR is the top one at 73. Chronic is syphilis at 16. And that's interesting because syphilis appears to have a similar frequency to things like Rocky Mountain tick fever, Lyme's disease, malaria. We've seen a pattern where those frequencies are similar. So that is really what I expected to see on this panel. Okay, we'll test the next panel, the stress test. Okay, it looks like emotions. So we had talked about emotions earlier, and also it makes me wonder on this chronic here if that has anything to do with the dental that showed up. Okay, we'll do the age testing. So we're constantly looking for clues of how we can best help our clients get the most relief from the stresses in their life. So we've got a metabolic, which that's at 52. I wouldn't really worry about that. Really, I wouldn't worry about any of these age responses. It's kind of appropriate for his age. Let's look at the general factors and see if we have anything here that might tie in. But my main concern on this screen was the miasmic factors because of the history, especially after what I saw in the reactivity. That's exactly what I would be looking for in this panel. And also the fact that his skin did show up several times. So the red and the green were spot on as far as connection with the reactivity, in my opinion. So on here, it looks like parathyroid. So possibly later on, we might look and see if there's any calcium imbalance. Collagen, there, the skin that was showing up, and free radicals. So that all makes sense. And what I would do is I would do a minute on each one of these panels for feedback. Okay, after our feedback is complete, we'll go to our board where we've already added the items: parathyroid, syphilis, tick-borne, which we tied to the parasites in tick-borne, and we talked about the same frequencies. So we're in collagen in the skin. The skin came up acumeridians and emotions. Next, we will go on to CellCom. So we go to Wellness Panel. We'll go to CellCom and test CellCom. We'll be back as soon as this is finished testing. Okay, we've finished running the test CellCom right here. And we've come up with some acute and some chronic. So the first acute is pneumonia, which the lungs have come up several times. Elbow joint problems, which the shoulder and the neck have both come up. It'll be interesting to see what the spine says when we get there. Nephrotic syndrome came up as a stressor, which the kidneys have come up several times. Eye sticking pain. We've talked about weakness of the eyes. Here we go down to the bottom, and we've got vitamin B and the bioflavonoids, and we will look into that when we get to the vitamin mineral panel. We have fluoride. We can see if that comes up at the detox. The immune system weakened against infection. Of course, we've discovered several things that could cause weakened immunity. And then the lymphatic drainage. Okay, we've completed the CellCom, and we need to list them on the board. We already have them listed. Pneumonia lung, which ties into the vascular cardiac. Elbow joint, and that has to do with inflammation and joint pain. Nephrotic has to do with the kidneys, and we found that on acumeridian. Eye pain, weak eyes. Vitamin P, bioflavonoids, which is a vitamin B, it has to do with the vascular system, immune system, and lymphatic system. So now we're going to go on to the chakras, step 5. And we're going to test the chakra. We're not going to bother with the colors today. We're just going to test the chakra. Now, on chakra, we're going to go to our next chart. And this is one of the charts that you can download on biofeedbackwc.com. And we're going to look at each chakra. We're going to definitely look at the ones under 10, and we will look at the top 3. And we'll just compare with what we found. Another piece of the puzzle. Chakra is very important because of the energy flow from the base to the crown. Super important. Now, base is red and it's 57. I really do not worry about that. The sacral is very low at 14, and knowing this client has back pain, that would concern me. Heart, we know there are heart issues, and it's chronic, that concerns me. And then we also know the issue with the brain, the strokes. And so in this panel, I would give each of those a 3-minute feedback. Now, if you go to your chart, crown is pineal, musculoskeletal, skin, depression, light sensitivity, and exhaustion. Now, this is really interesting at that being 8 because pineal has shown up, and we just assume that there's probably some sleep issues. And that could even be tied in with the parasympathetic stress that we found. Musculoskeletal, he's got one leg shorter than the other. The skin has shown up on several panels. Depression has shown up on our reactivity. And also light sensitive, the eyes, and exhaustion. So all of that ties in. Then we go to the heart. We've got the heart, lungs, the thymus. Now that's really interesting. The thymus actually was on the previous test. And I believe that, that definitely, the thymus is the soldier that kind of monitors the blood for bacteria. So that definitely is an issue. And there's the arms and shoulders, the diaphragm, asthma, and allergies, which we've already confirmed. So that lines up. And then the sacral is the sex organs, large intestines, bladder, hip, pelvis, and urinary. We've already discovered that there are several kidney stressors. There are hip stressors and also some digestive stressors. So that all lines up with what we've already discovered. So we've completed the chakra panel, including the feedback, and we gave it a 3-minute feedback. And also it's good to give a 1 minute on the chronic. Now we're going to look at the board where we've placed our findings. Pineal, skin, which is shown up several places. Depression, we talked about possible depression and sleep going together. Light sensitivity with the eyes in several panels. Respiratory, circulatory seems to be a theme. Shoulder, arm, lots of chest and shoulder, arm coming up as stressors. Allergies, kidney and bladder. Kidney is shown up multiple times, and digestive. Okay. We've completed the chakra. Now we're going on to the dental and the wellness panel. Okay. I've already completed the test for time. We're going to use this chart, and if you'll notice, the chart's divided between blue and yellow. Blue being the right side of the mouth and yellow being the left side of the mouth, and they're mirrored images. It also shows what organs and glands are affected by each tooth and what vertebrae on the spine. So the first tooth that is mentioned here is in the lower right. So we go to the lower right, and it's the second bicuspid. So I find the second bicuspid, which is number 29, and I write it down. I go to my list here, and the second bicuspid, lower right, includes the pancreas, the stomach, and the thyroid. It also includes T11, T12, and L1. So I'll make note of that, and also make note of the organs that it affects, because we know that the stomach has shown up in previous testing. The second stress that's showing tooth-wise is the first bicuspid, upper right. So we go to the upper right, first bicuspid, number 5. And so we go to number 5 here, which is the lungs, large intestines, and the posterior pituitary. Also, we look at T11, T12, and L1 again. So that's really interesting that it is pointing to those vertebrae again. Now, the third one is cuspid canine lower right. So that actually is just the canine here, and it's number 27. So we go to our chart, number 27, liver, gallbladder, gonads, T9 and T10. Really interesting, the thoracic area, and I'll be really excited to go to the spinal panel and explore that more. Now we're going to go down to the bottom, and we're going to see what the chronic stressor is. It's a third molar, lower right. So that's number 32. We go to 32. Very interesting. It says chronic because we have heart, small intestines, triple warmer, circulation, and sex organs. Also, this is interesting. We have C7, T1, T2, T6, S1, and S2. So we know the shoulder has come up, the chest has come up, and then also the lower back because of the legs, and then the heart, the digestion, circulation, all of that matches. What I would do in this panel is I would run 1 minute on each of those. I would be sure and balance each one. So I would run 4 minutes on this. And it would not hurt to do inflammation and degeneration on this also. So now that we've completed the dental profile, we're going to go on to the next session. So we've completed the dental and we've posted it on our chart. The tooth number 29 relates to stomach issues that we've identified. And the T11, T12, L1 Tooth number 5, lungs, large intestines, again, digestive, and also the lungs have shown up, T11, T12, and L1. 27, liver and gallbladder, T9 and T10. And number 32, heart, small intestines, triple warmer, and circulation, C7, T1, T2, T6, S1, and S2. We're going to go on to the detox panel. So we're going to go back to the wellness panel. We're going to go to the detox panel. And we're going to test the environment. We will return after we've tested the environment. We'll test pathogens, and we'll test the personal, and we'll be right back. Okay, so we've run these 3 tests, and you notice in red at 84 we have pharmaceuticals, and then on chronic, radiation on environmental. So the radiation makes sense with the skin, and also the pharmaceuticals being that he takes, quite a few prescriptions on a daily basis. Now the fluoride did not show up. We'd talked about looking for that earlier. In the pathogens, we've got fungi and sugar toxins that are both high, and those a lot of times go together because sugar seems to make fungus grow. That could affect his lungs, his sinuses, those stressors that he has encountered in the previous test. So we make note of that. And then we notice the vaccines and the prions are both at 10, and we've noticed a pattern because prions seem to be altered by vaccines, and so both of those are at 10, so we would make note of that. And then mental toxins are at 78. We know he's depressed, and that's concerning. And then tobacco is at 10, and he had a history of smoking in his 30s and 40s. So that makes sense. And then pork and beef toxins, and he is a beef producer. So that fits in. And if you'll notice on our board over here, we have noted pharmaceuticals, radiation, which ties in with the skin that we've saw earlier, fungus and sugar toxins. That could be the digestion, it could be the lungs, and it could be the sinuses. Vaccines and prions, mental toxins for the depression, and of course the tobacco. We do know that he was a smoker. So the next thing that we're going to test are the organs. So we're going to go on to the organ panel. Okay. Oh, and back to the detox panel, I would run the 5-minute detox. I would just run the 5-minute on all 3 of those. That's the reason I like to go ahead and test all 3 of those and just run the 5-minute feedback. It's very effective. Also, while we're doing this baseline testing, we're giving minimal feedback right now, but the whole concept is to come up with a perfect strategy to address your client's stressors. So all of this information together is going to give you a direction and strategy of the way that you need to help this client. Okay, so here we have heart, and that's very interesting, and we know of the heart problems. Pancreas, and of course sugar toxins came up, so that really doesn't surprise me. Stomach, and then it's really interesting of the thoracic, because we had in the dental profile, we had the T9, T10, T11, and T12. So that's very interesting that that's in chronic, and we're going to look at that further. But of course, the digestive, the sugar toxins, and the heart. I would do a 1-minute feedback on the red, yellow, blue, and a 1-minute on the green in this, and go on to the next panel. So we've discussed the organ profile, and we have recorded on our chart under organs, heart, pancreas, stomach, and thoracic. So now we're going to go on to number 9, which is spinal. So we'll go back to the wellness panel, and we'll go to the spinal profile, and we're going to test potential. With the spinal, we're going to use this chart. Shows all the organs. And then on the back, it shows the possible stressors that we might see. This is a very handy chart. It goes from C1 to L5. It also covers the sacrum and coccyx. I will tell you, even though this is different, I used this chart with animals also. Very handy with animals. Yes, their structure's a little bit different, but this is very revealing. When you run the human test on an animal, it will result in great information that you need. I mean, it's really important information. Just like on the human, you'll receive the same information on animals. So here, what we would do is I'm going to turn my page, my little notes that I keep, and I'm going to record everything. The red is 65, which is really interesting, is T12, and we'll come back to that. But I'm going to start with C1, and I'm going to record everything that I see that is below 10 and above normal. So C1 is 2, and C2 is 56. Now, I really don't worry about the 56 in a normal situation, but with the C3 being 7, I would make note of the C2 at 56 because there seems to be a pattern there with those 3 vertebrae. I would go down to the T1, which is 6, the T3, which is 4, the T5, which is 3, the T7, which is 2, and it's the chronic. If you'll notice, the T9 was listed in the T10 earlier in our dental. I would note the T9 just because it was mentioned, and it is 11. And then your T11 and T12, I would note those two because those came up in the dental, and they're 55 and 65. So there's something going on there. I would go down to the lumbar, and if you look at the L3 is 7, the L4 is 6, and then the sacral is 52. So those are the ones that I would go with. I would get my chart, and if you look at the C1, it's blood supply to the brain or head, which is very typical with a stroke victim. It has pituitary, brain, inner ear. The ear came up earlier, so I would make note of those. The C2 is the ears and eyes. We had quite a bit of ear stressors come up. Sinuses, tongue, and brow. So we had sinuses, eyes, and ears. Okay. The C3 is outer ear, teeth, and facial nerves. So we know that we had some tooth problems. T1 is hands, wrist, and fingers, arms, esophagus, and trachea. So the hands, wrist, and fingers and the arms, they came up with the arms and shoulders. So, you know, that ties in. The T3 is the lungs, bronchioles, and pleura, and the breast. So the lungs come up several times, and then the mastitis, so that ties in. The T5 is liver, solar plexus, and blood circulation. That definitely fits in. The T7 is the pancreas and the duodenum. So the pancreas, remember the sugar toxins, and then the pancreas came up. And the duodenum has to do with digestive, so that also makes sense. The T11 is kidneys, and kidneys have come up multiple times. And the T12 is the small intestines, the lymphatic circulation. And so both of those tie into what we've already witnessed. L3 is the sex organs, bladder, and knees. So definitely the sex organs have come up, which and the bladder and the knees with the short leg. Okay. The L4 is the prostate, the lower back muscles, and sciatic, and all of that have come up. Now, what I do is I look and just see if there's any symptoms of the same ones that's come up. So C1 symptoms would be headaches, insomnia, and fatigue, high blood pressure. really all of those could fit with this client. And that's a question that I would be asking them. C2 is sinus, allergies, earache, and sight loss. All of those fit. C3 is ringing ears, neuralgia, and skin issues. All of those fit. T1 is shortness of breath and carpal tunnel. Don't know about the carpal tunnel, but the shortness of breath is definitely a symptom that we've witnessed with this client. T3 is bronchitis, pneumonia, flu, and congestion. Pneumonia did show up earlier. T5 is liver stress, low blood pressure, anemia, and arthritis. All of those could fit in. You know, it had the pharmaceuticals high, and your liver is trying to filter that out. We know we have blood pressure issues, we have blood issues, and then we have a lot of pain. T7 is ulcers, gastritis, and diabetes. Well, we know we had sugar toxins in the pancreas that show up, and we also have had quite a bit of digestive issues. T9, allergies, hives, high blood pressure, anemia, or obesity. T11, skin conditions and autoimmune disease, so definitely the skin conditions. T12 is joint pain, gas, and bloating, which the digestive could cause that, but we do know we have joint pain. L3, bladder issues and knee pain, that's fit. And L4 is urination issues, backaches, and sciatica. So all of that fits into the pattern of everything that we have discovered so far. So we're making note of what we found in the spine on our board. So we've listed C1, blood supply to the brain, C2, sinuses, C3, ears and teeth, T1, arms and shoulders, T3, lungs and breast, T5, liver, T7, pancreas and duodenum, T9, adrenals, T11, kidneys, T12, lymphatic, L3, bladder and knees, L4, sciatic and lower back. So we've made note of those, and we're going to go on to our last panel, which is minerals, amino acids, and vitamins. So we go to the wellness panel. Oh, and one more thing about the spinal panel. I'm going to go back in there. The 2-minute special. I love the 2-minute special, and sometimes I will run that a couple times. It will do the whole spine. It's a quick way to do it, but it's very effective. And in this case, he has so many stressors in his spine, I want to get all of them. So 2-minute special over here in the corner under bio-specific stress. I love it. Now let's go to wellness, and let's go to the vitamins and minerals. So we're going to test all 3 of these, and we'll be back in just a moment. Okay, so we finished these 3 tests, and we're going to go and review each one of them. So let's start with the minerals. Aluminum shows 9, and I like the others, I like to look at anything under 10, and I also look at ones on the higher level, most usually 70, 75, above that is what I look at. So aluminum it activates enzymes, so it's really important. Arsenic is a carcinogen, so it shows low on a chronic level, and I would look at that maybe if they had a cancer stressor, but let's move on to boron. Boron shows on the high or side, which it just because it's on the high side doesn't mean that it's not chronic. It just happens to be in the top 3. And boron has to do with bone health, calcium metabolism, and if you'll remember, the parathyroid showed up earlier. It also has to do with phosphorus metabolism, magnesium metabolism, and brain function. If you go to the symptoms, low boron could be low calcium, phosphorus, magnesium, and it also has to do with the reproductive, if you have a younger person that is having reproductive problems. So that would be boron. If you go on, you look, the calcium is at 3, which that ties into the parathyroid, it ties into the boron being low, and that builds bone and teeth. It is tied into regular heart rhythm. It eases insomnia, maintains the muscle and nerve function, and it aids in blood clotting. And this client has reported having TIAs on a monthly basis. So if you go around to the symptoms, we've got brittle bones, muscle spasms, leg cramps, osteoporosis, tooth decay, and you could have strokes also with a low calcium. The next one is chromium at 70. Chromium works with the insulin and metabolism of sugar. Well, we had sugar toxins, so the sugar was not being metabolized according to the stress, reduces cholesterol, transports amino acids, and controls appetite. If you go around here, low levels can cause fatigue, it can cause cancer, and it also can cause cardiac issues, which we already know that this client has. We go down, and the next one under 10 is iodine. So iodine we know is very important for thyroid function, and it actually makes the thyroid hormones, thyroxine. It helps with healthy metabolism and burns excess fat. If you go to the symptoms, low levels can cause obesity, hair, skin problems, and teeth issues, which we know skin and teeth issues have come up multiple times. In addition to, it can cause hypothyroidism. Iron is at 1. That's the next one. It makes hemoglobin, healthy brain function, hormone production, oxygen to lungs, and oxygen to muscles. All of that definitely ties in. And low levels can cause anemia, weakness, shortness of breath, pale skin, irregular heartbeat, fatigue, and dizziness. And we have seen all of that in a pattern. Manganese is the next one. And manganese rids free radicals, breaks blood breakdown of amino acids for energy, metabolism of B1 and E, and activates digestive enzymes. I just want to take a break because it brings up B1 and E, and let's just look. So B1 is at 77, so it definitely is out of balance, and E is at 29, so not so much. But it could be either or both, and we do see a pattern there. And we'll talk about B1 when we get to it. Okay, so nickel. Nickel, it aids the body in absorbing iron, and that's really interesting that the iron was low. So that's the importance of nickel. It also metabolizes glucose and adrenaline. And if you'll remember, we've had several blood sugar issues that show, or stressors that show, and also the adrenal glands showed up, red blood cell synthesis. So we've had several symptoms. Nickel high levels can cause cancer, heart issues, or prostate issues. Okay, so let's go on down here to potassium is at 10. Potassium regulates waist, normalizes heart rhythm, oxygen to brain, clarity, regulates pH balance, which helps prevent cancers, and healthy skin. So if we go over here, poor levels are poor reflexes, central nervous system disorder, respiratory and heart stress. Okay. And sodium, if you'll notice, is on the high side, but that it could be chronic, and it's just in the top 3. So vanadium is the last one. Vanadium lowers the blood sugar, improves sensitivity to insulin, which that's really interesting with everything else that's going on. That piques my interest. Lowers LDL, bad cholesterol. Now, vanadium, low levels could be diabetes, bone breakdown, tooth decay again, and high cholesterol. And if you'll notice, we have already taken the time to note all of our minerals up on our board. The boron, calcium, chromium, iodine, iron, manganese, nickel, potassium, sodium, and vanadium, and we put the commonalities to what we've already witnessed. So when we come back, we'll go over the amino acids and the vitamins. Okay, so now we're going to cover the amino acids and the vitamins. If you look here, the first amino acid is adenine. And that has to do with, it's an energy carrying molecule of ATP, adenosine, and low results in possible UTIs, kidney stones. So the kidneys have shown up, so that does make sense. Arginine is for wound healing, liver regeneration, muscle growth, improved immune response. We've already witnessed several of those. And if the arginine is low, then sometimes you may have too much lysine or histidine. But in our case, we do not, both of those are out of balance chronically, so it could mean that they've chronically been high. And that's probably something that we would just kind of keep an eye on and watch. Okay. Next is cysteine. And our cysteine protects against radiation and pollution. If you'll remember, radiation came up in detox. It neutralizes toxins, and it makes collagen, and it makes up 14% of the skin and hair. And the skin has shown up several times. So if your cysteine is out of balance, you could have cardiovascular disease, ischemic stroke, which he has reported having TIAs, neurological diabetes. We've had that blood sugar come up several times, and renal dysfunction. So the cysteine is tying into a lot of what we have witnessed so far. And then the cytosine is at a 3, and the cytosine is a nucleotide in RNA, and it works with adenine, guanine, uracil, and thymine. The cytosine, low levels can cause anxiety, Parkinson's, or even seizures. So let's go on down to guanine. And guanine is actually a nucleotide in RNA, and it works with the cytosine, and it can cause neurological disorders. Okay. And so next is histidine. Okay. Histidine is in hemoglobin, helps with allergic diseases, which we've seen allergies, we've seen blood issues, preventions of ulcers, and we've saw digestive issues, and it also helps with rheumatoid arthritis symptoms, and we know there's a lot of aches and pains. And so histidine, low levels can cause intestinal issues, RA. It works with vitamin B and folic acid. So if vitamin B or folic acid are low, that really makes sense. And if you look over here, you've got some Bs that are multiple Bs in the B complex area that are out of balance. And you also have folic acid out of balance. So that is tied directly. Okay. So leucine. Leucine protects the human growth hormones, controls blood sugar, heals skin, heals bones, and helps keep a lean body mass. Now, the leucine is chronically low, which several of them are, and leucine works, if it's low, sometimes there's a zinc deficiency. Now, our zinc's not too awful low, but that's something that we would watch, and it causes digestive issues, hair loss, and skin rash, and the skin has shown up multiple times. Okay, going on down to the serine, which is at 4. Remember, we're just looking at everything under 10. And if you want to take more time, you can include everything under 15 because those are fairly low at that level, but that's just totally up to you and the amount of time that you have. So on the serine, it improves attention, cognitive, and memory. So, with what's going on with my client, that makes sense. And if it's high, there might be a B6 insufficiency, but the B6 is at 19, so that's kind of iffy. And then the threonine is at 19, and that could be low with high levels of serine. Moving on down, We're looking at tryptophan. It's showing at 65, makes melatonin. We've talked about sleep problems, regulates pain, and it also produces B3 for energy, or niacin. And the niacin level's at 24. That's not real, we're looking for around 50 for balance. So it's not good, but it's not bad. So tryptophan, the symptoms are neurological, depression, anxiety, and irritability, hard to concentrate, and insomnia. So that really ties in with everything that we have seen. So this is your amino acid chart, and we're going to go on to vitamins now. And so with the vitamins, we're going to start with B1. B1 is nervous system, brain stem, muscles, heart, stomach, and intestines. That really fits. And when B1 is out of balance, headaches, nausea, fatigue, irritability, depression, abdominal discomfort. People with thiamine deficiency also have trouble digesting carbohydrates. And so that's at 30, so there's not an issue there. And so then we look at B12, which we know B12 is tied to the blood cells, nerve cells, and DNA. And of course, B12 deficiency, if it's low, nausea, headaches, dizziness, and also blood clots can be formed if B12 is low. The vitamin C. So vitamin C, blood vessels, cartilage, muscles, and cartilage. We've already know that the blood vessels, we know there's cartilage and muscle issues, and we also know there's skin issues. So we go to symptoms. That could be nausea, fatigue, easy bruising, bleeding, joint pain, and rough, bumpy skin. So it really fits in with the pattern that we're seeing. Last is folic acid. And folic acid, we talked about that earlier. It has to do with RNA and DNA. And if you're low on folic acid, you can have nausea, diarrhea, irritability, confusion, skin reactions, seizures, numbness and tingling of feet and hands. And if you'll remember, it talked earlier, I believe it's in the spinal, about the hands and the arms and fingers. So everything in this case is tying together. And we have already placed these on the board up here. You can see we did adenine, arginine, cysteine, cytosine, guanine, histidine, leucine, serine, tryptophan, B1, B12, C, and folic acid. And we talked about how all of those fit together. Okay, so we've completed our 10 steps in baseline testing. And we've created a pattern, and we've actually went over each of the modules on the wellness panel and the reactivity. And we've added some things to this. So we definitely have found stressors of weak vascular and cardiac, inflammation and pain in the chest, neck, and shoulders, lower back and knee pain. Also talked a lot about arthritis, endocrine, blood sugar came up quite a bit, adrenals, parathyroid and calcium production came up, pancreas, and then kidneys was repeated multiple times, respiratory, allergies, sinus, and COPD, sleep and depression, digestive, and skin. So in the future, what I will do is I will create a custom program for this client and work on these areas. And what I will do is I will run a baseline testing once a month to see the progress and see if I need to change any of these. But I would use the same format in mapping it out. This process actually takes about an hour and a half. And that's the reason that you do the minimal feedback for the first time, because the importance of the picture, you'll realize as you continue to work your clients and see the progress. One thing that I would do is I would suggest that this client have 3 different pillowcases with the fractal images and sleep on them at night. And this is the endocrine. It's the number 4. And that has the fractal image for the thyroid, the parathyroid, the pancreas, and the gallbladder. It has all the fractal images to give it an energetic balance with just a gentle frequency as this client sleeps. I also would suggest that they rotate with the circulatory respiratory. And if they're sitting around the house and not feeling good, they can just take this pillowcase and lay it on top of them. I suggest people put it under their shirt, but a lot of the clients get great results with that. So that's another one. And the last one I would suggest is the musculoskeletal to help with some of the joint and muscle pain that this client has. So those are the 3 pillowcases that I would suggest this client rotate. And before we leave, I just want you to notice in the background, I have another system running here, and it's just a little insight to biofeedback with one click. I appreciate you participating today in the webinar, and I hope to see you soon in the future. Thank you. I would like to share my personal health journey. Being born with severe allergies causing asthmatic bronchitis episodes, resulting in multiple hospital stays, being a horse trainer starting at a young age and continuing on into adulthood, competing in professional rodeo, I've experienced a lot of trauma. With all of this said, since using the Biofeedback life system, I've noticed dramatic changes in my health. Number one, the allergies no longer appear. The symptoms of the allergies are gone. The asthmatic bronchitis symptoms are gone. Trauma and accidents I've endured, such as a dislocated shoulder, broken collarbone, broken ribs, that used to wake me up during the night with pain, it's all gone. I no longer hurt anywhere. I feel great. I work 16 hours a day, and I'm in my late 50s, and I think that says something about the life biofeedback system. I'm on no pharmaceuticals. It's just really, really improved the quality of my life. And I'm so thankful for the life biofeedback system, and I believe in it. And I just pray that each of your journey quest for health will result in the same as mine.
Hi, I'm Dr. Gena Keeling, DVM, and I want to share a short version about my journey to better health with you. A year ago, I was having severe back issues, and I was diagnosed with deteriorating facets in my back, and I also had disc degeneration. And the only option I was given was to either continue the steroids or live in pain. And there was no positive outcome if surgery was attempted. Prayer led me to the Biofeedback Wellness Center, where Stephanie introduced me to the life system. After the first session, my pain had decreased significantly. After 3 sessions, the stabbing pain that I felt in my back was alleviated. And I was ready to purchase the life system for my own use and for my animal patients. I've received many positive testimonials from my patient owners after using the life system in helping their animals and indicating the stresses and sending positive feedback through the life system. Hi, I'm Dr. Gena Keeling. Today we're going to take you to a virtual farm visit, and we're going to a large goat and sheep conditioning unit. And when we got there, the owner informed us that he had one particular lamb, number 371, that he wanted us to view. And when we did our initial assessment on lamb 371, he was recumbent, his breathing was distressed, he was grinding his teeth, and had some neurological dysfunction. So immediately we decided to give the lamb some pain frequency. And when we gave this lamb the pain frequency, it seemed to be a little more relaxed, and we hoped that this giving the pain frequency first would make it more receptive to the other frequencies. Then we started our baseline testing, and 30 minutes into the baseline testing, it was amazing what happened to this lamb. He started flickering his ears, and if you watch this video really careful, you can see him. But then he got up. 30 minutes, that's just 30 minutes into the baseline testing. So we took our harness off and let him walk around. We continued with our baseline testing by using the hair on our box, or wool on our box. And he got up, walked around, drank the water, stayed up for 15 minutes, and then he went back over, laid down, and started munching on the hay. And 3 days later, we contacted the owner, and he said that this lamb was still doing well. Before we left, we put a bandana on the lamb. We put a frequency bandana on the lamb so that he would continue receiving some positive energy. And now we're going to take you to our findings. Now we're going to explain to you what I found at the farm and kind of tell you my thinking process as we go through our baseline test results. So we have done our reactivity and we found our stressors. And I've identified stressors as being emotional, respiratory, gallbladder, central nervous system, muscular, gastrointestinal, and skin. And after I ran my reactivity, then I went around and I ran my baseline test, and I chose 9 panels. I did not do the dental panel in mine. I did the susceptibility instead of the dental, but I started with the meridian, and I found sympathetic, parasympathetic, gallbladder, ear, and emotion stressors, heart stressors, and stomach and esophagus stressors. So I identify those and write those down. And then I come back over here and I look, and I start looking through here and seeing how they tie in. And well, I see stomach ties into the gastrointestinal. And then esophagus and nose, well, that could be respiratory. Sympathetic and parasympathetic, that's our nervous system. Gallbladder, gallbladder. And then I continue my other panel, and miasms was my next panel, and vaccinosis, syphilis, psychosis, collagen, and emotions. So we're back to emotions again in our reactivity panel. Collagen, psychosis, and emotional. Vaccinosis, I know that this lamb was pre-processed with a bunch of vaccine and antibiotic when he first arrived at this farm. Then I move on down and I test my cell comm, and pneumonia and lungs, elbow, joint, biotin, carb metabolism, intestinal pain, immune system, and lymphatic system. So I tie this in, look back up here to my reactivities, and I see there's respiratory again, there's muscular and bone, carb metabolism could be digestion, intestinal pain could be digestive. And then I continue on to my chakras. Base is muscles and immunity. And we have muscular up here in our reactivity. Throat could be respiratory again. Heart. So sometimes we want to add things in this reactivity panel too that we're coming across. And at the end, I'm going to add a few things in here. And then sacral is lower back and intestines. Heart is the lung and shoulder, so there's some more muscular. And susceptibility, allergy, which ties into respiratory, circulatory, digestive, amoeba, and parasites. And we're going to add parasites to this reactivity panel in a little while. And I know for a fact that this farm has had a parasite problem because I've done fecals on it, and we have a lot of parasite stressors on that in that barn. So our detox panel suggests pharmaceutical stressors, parasite stressors, sugar and food toxins, amoeba, and mineral toxins. Another thing I know about this particular lamb is that it came into this barn 2 weeks ago, and prior to that time it had been like a free range, a pasture lamb. So coming into a unit that is crowded and confined and you have to share with a bunch of goats, could definitely create some mental toxins. So that could lead to these emotional problems. And then your sugar and food toxins, this lamb was not used to a high concentrate diet. And that is what it is getting once it entered this barn. It's getting a high concentrate diet. And again, the parasites, which I know we have a problem in there because I've tested multiple lambs in there with parasites, and sheep, goats too. And then we go to the organ profile. We have our small intestine, our pituitary, our heart, and our lungs. Again, we relate these back to our reactivity panel, and we find out we've got respiratory, intestinal, circulatory. And then we move on over to our spinal profile, and we check that. And we got T1, T4, T6, T9, T11, L1, L5, and sacral. And we use our charts. We use our charts to figure this stuff out, see what it tells us in our charts. So T1 is connected to trachea and esophagus. T4 is gallbladder. T6 is stomach. T9 is adrenals. T11 is kidneys. L1 is large intestine. L5 is sciatica, and sacral is the hips. So we know that we've got problems with this lamb and his hips and sacral area, and unable to rise, can't stand, falls down. So we're going to connect that with our muscular and our nervous system. And the T1 with trachea, we're going to connect with our respiratory. And it's stomach down to the gastrodigestive system. So we're going to continue on with our minerals, and we look at all these minerals which are stressed. Same with our amino acids and vitamins. We have a lot of stressors in there, and that could be very well true since we have a gastrodigestive disturbance. Maybe our intestines aren't absorbing what they need to, so we can get stressors in these areas. And what I do next is I take all this information and I compel this animal, I compile it. I make this animal a custom profile, is what I do, and I send it the frequencies from the custom panel. Next is I view all my other stressors that I didn't write in my reactivity panel, and I come back and put them in my reactivity panel, such as parasites, I'm going to add heart. Once I get these in here, I make a custom reactivity panel for this animal so that I can give it frequencies throughout the week. And sometimes when I go on the farm, I'm not actually able to write all this stuff down right at that very moment. So what I like to do is I come back or while I'm running the profile, actually, I take and once the panel's ran, I come over here and I clip and snip. Okay, I take the 4 little boxes and I put my finger on that, shift and S, and I just clip and snip them. And then I come up here and I find what I want and I outline it. Just like that. And then I come over here and I save it. And then if I want to pull it up for later, I can do that and I can copy it off. And I have my little profiles all printed out for me. I'm glad you came today, and I want to thank every one of you who viewed this and allowed me to share my experiences using the life system with animals. And I really want to thank Grace Gal for giving me this opportunity to share my experience of the life system. Thanks a lot. Bye.
Disclaimer: the content and material presented in the Life-Inspired Lecture Series is for educational and informational purposes only. It is not to be used for diagnosis or treatment of any condition or disease. The Life System is a stress management tool. Please stay within your scope of practice when using the information presented in this lecture series. Thank you for joining us today. Watch your email for information about the next Life-Inspired Lecture. From all of us, we are sending you light, love, positivity, and, as always, inspired connection.